This is a video describing the components of and the protocol for the use of the Crestal Sinus Elevation Kit. We have developed practice modules out of Sawbone number 15, polyurethane material of similar density to maxillary molar bone, to provide some hands-on tactile sense of the determination of membrane presence by probing. The Sawbone modules are available in 3 different densities, 10, 15, and 20. These densities are similar to the density of bone below the maxillary sinus. Chambers have been milled out of half-inch blocks to represent maxillary sinus chambers to illustrate sinus elevation drilling protocol at 200 RPM for this demonstration. Normal drilling speed of 500 to 600 RPM is recommended with patients. Each module has 6 surfaces to practice to lift the sinus membrane and to get a feel for the resistance attributed to the sinus membrane when probing. The Schneiderian membrane is on average 1.6 mm plus or minus 1.2 mm in thickness. This was reported in a CBCT study of 76 patients, published in the International Journal of Implant Dentistry, in October 2018. The series of sinus elevation drills was developed, with reverse threads to push the bone forward to lift the membrane. By increasing the drill lengths 1 mm at a time, one can drill through the bone of the sinus floor without perforating the sinus membrane. This protocol is based on the use of drills with reverse threads which push the bone forward. By increasing the length of the 1.5 to 2.2 mm drills at 1 mm intervals, the membrane is finally reached and lifted. The diameter of the osteotomy is then increased by using larger diameter drills of the same length to push additional bone particles forward. Once the membrane is elevated, the membrane elevation can be increased even further by pushing collagen or other graft material into the osteotomy using.
Each piece of collagen-based material, osteogen for example, is placed with collagen pliers and pressed in place with a concave plugger.
It is important to start the membrane elevation with a collagen-based matrix which is soft and less likely to perforate the membrane. After the initial elevation, the collagen graft material can be followed with any mineralized graft material to make the graft more radio-opaque. A biologic such as infuse of Gem21S can be added to speed up the rate of mineralization of the graft. Simultaneous implant placement works well, unless you have less than 3 mm of crestal bone to stabilize the implant. If there is less than 3 mm, there is a high risk of implant loss unless the implant is attached to a titanium plate to stabilize it. The storage container is metal with silicone inserts to hold the Lindenman-type drills while cleaning. It can be placed and stored in the freezer after autoclaving and will keep the drills cold for 15 to 20 minutes while the sinus elevation is completed. There is also an optional aluminum storage block that will stay cool for 40 minutes, which is available on the website. The use of pre-cooled drills allows one to complete the sinus elevation without the worry of getting too much cold water in the osteotomy. This is very important when using a biologic like BMP2. Diluting the biologic would have an adverse effect on the length of time required for the mineralization of the graft. We have also found the patients have a significant less amount of discomfort when the bone remains cold with the procedure. There are 35 drills in the sinus elevation set, 7 drills in each diameter. The lengths are 4, 5, 6, 7, 8, 9, and 10 mm. This is a flow chart of the drills we will be using in the following Sawbone examples of a sinus chamber. The arrows indicate the order of the drills used on the sinus model. We will start the osteotomy with the 4 mm gold drill, then increase the length of the drills by 1 mm intervals. 5 mm, then 6 mm, then 7 mm, at which time the membrane is reached. Then we will only increase the diameter of the drills, continuing with the 7 mm length. If there is any doubt about the thickness of the floor, start with the shortest 4 mm drill. If the bone thickness is less than 4 mm, you may want to do a lateral window sinus elevation. The second drill we are using is the gold 5 mm drill. Probing the bone after each drill is a good idea to learn the feel of the density and resistance of the bone in the sinus membrane to probing. The 6 mm gold, 1.5 to 2.2 mm tapered drill is used next. The 7 mm gold drill is used next. The probing feels soft, so we will check it again with the larger 2.5 mm probe. The larger probe does not penetrate, indicating we are at the level of the membrane. The 1.5 mm opening in the bone is large enough for the narrow probe, but not large enough for the larger 2.5 mm probe. The next drill is the rose-colored drill, 7 mm long but larger diameter, which will remove bone from the osteotomy wall and push it up to elevate the membrane. The blue-colored drill is used next. It is a 2.7 to 3.2 mm tapered drill. The larger 2.5 mm probe is used again, to check the resistance to probing. The 7 mm silver drill is used. It is 3.0 tapered to 3.9 mm, 7 mm long. The largest black drill will not fit in the 4.5 mm guide sleeve. You will have to use it freehand. The amount of elevation of the sinus membrane is dependent upon the density of the bone below the sinus. If the bone is type 4, the amount of lift will be less than is observed with type 2 bone. Now the probing feels soft with the larger 2.5 mm probe. The resistance of the membrane can be felt, indicating the membrane remains intact. Additional height can be produced by adding collagen with the adjustable depth stop plugger. The length of the depth stop plugger should be adjusted to the same length of the drills used to widen the osteotomy. The tip of the plugger should not extend into the sinus cavity more than 1 mm to avoid tearing the sinus membrane. The graft material should start with a collagen-based material such as osteogen, which is filled and will not compress like a pure collagen plug. The material can be parcelized into small pieces and inserted into the sinus cavity with a cotton pliers and pushed up with the plugger. Verifying the membrane status. To verify the membrane status, 1. Use the Valsalva maneuver, or 2. Probe gently with the narrow 1 mm diameter probe. If the probing feels hard, you are not through the bone. If it feels soft, probe again with the larger 2.5 mm probe. If the probing feels hard with the 2.5 mm probe, you are at the level of the membrane. Verifying the membrane status. What if you have perforated the membrane? If it is just a small tear, you can proceed, but you have to go back to 1 drill diameter smaller and 1 mm shorter, and add more graft, then wait 2 months to take another CT to look at the sinus and decide whether to regraft, or to place the implant. An alternative is to stop and wait for the membrane to heal for 3 or 4 weeks and start over from the beginning, checking with the Valsalva maneuver to verify that the membrane is intact. Let's look at a case example with immediate implant placement simultaneous with the sinus elevation surgeries. A 60-year-old female patient who presented for replacement of the maxillary first molars. A non-smoker with no significant medical history. Here is the facial view of the patient's left sinus. These are the views of the patient's right sinus. A cone beam X-ray was taken. After the initial elevation with osteogen collagen plug particles, additional graft material is required to place a longer implant. A 10 by 20 mm osteogen plug is selected as the carrier. The osteogen plug is sectioned lengthwise into quarters. A biologic could be applied to the graft material to enhance faster mineralization. The quarters of the plug are cut in half to a size that is easily inserted into the osteotomy. Implants were placed at the time of the sinus elevation, and they were stable. The healing abutments are placed 4 months later, and their ISQ numbers were 78 and 82. The final restorations are screw retained to avoid any risk of cement below the gingival tissues. Periapical X-rays were taken to serve as a baseline to check on future bone levels.